What is up, future nurses? Today we are breaking down lipid management, the bread and butter of primary care, and an absolute NCLEX favorite. To start, let's look at how the body moves fat. Lipids are water insoluble, meaning they cannot dissolve directly in the blood. Instead, they have to travel through the bloodstream, wrapped securely in proteins as lipoproteins. To catch hyperlipidemia early, you have to memorize your target laboratory values. Total cholesterol needs to be less than 200 milligrams per deciliter. Your bad artery clogging low-density lipoprotein, or LDL, needs to be less than 100. Triglycerides should be less than 150. Finally, your happy cardioprotective high-density lipoprotein, or HDL, should ideally be greater than 60 milligrams per deciliter to act as an optimal vascular shield. Clinically, hyperlipidemia is known as a silent killer because it remains completely asymptomatic until plaque restricts blood flow enough to cause tissue ischemia. Chronically elevated lipids drive atherosclerosis, which is the progressive hardening and narrowing of the arteries due to fatty plaque buildup. When this restriction occurs in the heart, it causes coronary artery disease, which can easily progress to an acute myocardial infarction. If it happens in the brain, it causes a stroke. And if it restricts blood flow to the limbs, it leads to peripheral artery disease. When it comes to nursing interventions, the exam focuses heavily on patient education and lifestyle modification. The current standard is all about smart dietary changes. Move away from rigid, restrictive, don't eat fat instructions. Instead, teach patients to swap out dangerous saturated fats and artificial trans fats for heart-healthy polyunsaturated and monounsaturated options like olive oil, avocados, seeds, and nuts. Encourage a minimum of 150 minutes of moderate intensity aerobic activity per week to actively boost those cardioprotective HDL levels and lower triglycerides. We also have a critical post-surgical consideration. For patients who have undergone a cholecystectomy or gallbladder removal, you must explain that a temporary lack of concentrated bile limits their ability to emulsify fat. They must completely avoid high-fat, fried, or greasy meals for at least the first week post-surgery. Failure to adhere to this dietary restriction results in painful abdominal cramping and steatorrhea. When lifestyle modifications fall short, lipid-lowering drugs are deployed. HMG-CoA reductase inhibitors, commonly known as statins, are your first-line drugs. They block cholesterol synthesis in the liver, forcing it to pull bad LDL out of the bloodstream. They also stabilize existing fatty plaques, preventing them from rupturing. Statins should be taken with the evening meal because cholesterol is primarily synthesized by the liver at night. Memorize your lab values, understand how to manage cholesterol, and you will absolutely crush your exam.